Joining me now is Dr. Ken Kim. He was on the Biden-Harris Transition COVID Advisory Board and is CEO at both ARC Clinical Research and Cosmos Health Solutions. Dr. Kim, thanks for joining us tonight. Look, more than 18 months since the pandemic arrived in the U.S., you believe COVID is here to stay and that we all just need to start living as normally as possible. What does that mean?
That's a great question. I think COVID is going to be endemic, means we're going to have to live with it. And I know that Australia and New Zealand had a very interesting approach of trying to go to zero COVID. I don't think that's going to be a sustainable approach. Our businesses need to open, our restaurants need to be open, our schools need to open, we need to see our families. And I think that we need to be practical. We need to be really combining a number of different things. Each of us will have our own ways of dealing with this. And clearly in our personal life, in our own little personal bubble, we often don't mask, but when we go to work, we're going to have, depending upon the work situation, and depending on the number of people we're interacting with, and if they are strangers, then we are going to be needing to probably mask up. And then we go to large events. There's a wide range of ways that people are now trying to solve that problem. Here in California, if you go to a Rams game, you need to get vaccinated and you need a mask. If you go to a game in Texas, you do not need to get vaccinated and you do not need to be tested. So we're going to have to figure it out over time how we can adjust and make adjustments so that we can continue to live a normal life.
Right. I mean, so what should the metric be? Like, at what point should, for example, kids stop having to quarantine if someone in their class gets COVID?
Well, so I think if people are sick, they definitely need a quarantine. We still need to do basic contact tracing. And so clearly if there's a child who was sick or a coworker was sick, we need to also combine that with targeted testing as well as quarantining. So it will vary upon the circumstance.
I want to talk about boosters. This week, an FDA advisory panel recommended them for both Moderna and J&J vaccine recipients. Dr. Fauci thinks there is promising evidence for that. Here's what he said.
So the data we're starting to see from Israel indicates that even in a somewhat younger group, for example, from 40 to 60, there's a real benefit in getting the booster shot. So what we'll be doing here in the United States, both through the FDA and the CDC, will be to following these data as they accumulate in real time, and any modification of the recommendations will be based on that data as they come in.
So my understanding is you're not 100% sold on the need for boosters. You got the J&J, but you're still waiting to see if to get a booster based on your antibody levels. Why is that?
Well, so I think let's talk about both vaccines separately. For the Moderna vaccine, the efficacy in terms of preventing severe illness or hospitalization or death is actually held up quite well over time. And so it's interesting, when Moderna actually asked for approval for boosters, they didn't ask it based on preventing further illness, but preventing infection. That's a completely different goal than trying to prevent severe illness. Now, the J&J vaccine, as we know, was a one-dose vaccine. And it turns out its efficacy, clinical efficacy in terms of preventing severe disease or hospitalization, was a little bit less, 60 to 70% prevention compared to 94% range with the Pfizer and Moderna. So given that there's less clinical efficacy, I think there is more reason for those who receive the Johnson vaccine to strongly consider a booster or a second dose. The data so far has shown that those who got a second dose after 2 months had really a remarkable increase in antibody levels and decreased hospitalization. So the protection rate actually went up from 70% to 94% for those who got the second J&J vaccine.
Okay.
Now, for me personally, the reason why I'm waiting is it all boils down to basically risk-benefit assessment for each person. And I feel comfortable that the current vaccine, which I received in December as part of the clinical trial, I feel that at this time I probably still have adequate immunity. And that's because recently I tested my antibodies and they're still evident in the testing.
What you can do,
Other people may not
I know,
feel
I just want it for our viewers who might be wondering, I know you can get antibody testing at, grocery stores. It's just a blood prick. It's pretty easy to get, which I know can be, a question on people's minds as they're listening to you talk about this. Dr. Ken Kim, thank you so much for coming on and sharing your analysis on the current state of play with COVID. We appreciate it.
Thank you.